Honestly. I get more messages from people who are willing to try the peptides and they're like, I feel normal again. I feel human again. My brain's back. I have more energy. It's just like the ultimate in vitality is restored, and I'm not having
Right.
to use crazy amounts of hormones with a lot of
Mhm.
folks.
Do you feel like your hormones have turned against you? Trust us, you're not alone.
We're Dr. Serena and Dr. Heidi, and on Hormone Heroines, we explore all the root causes that are behind hormone imbalances, and we teach you how to thrive through them.
Join us for real talk, expert tips, and even a few laughs.
Hello and welcome back to Hormone Heroines. I'm Dr. Heidi.
And I'm Dr. Serena, and today we're going to be talking to Dr. Jannine Krause about when hormone replacement therapy isn't enough and how advanced peptides and bioregulator interventions can round out your treatment. Dr. Jannine Krause is a naturopathic doctor, acupuncturist, and the host of the Health Fix podcast. She helps women over 40 optimize their hormones, energy, metabolism, and longevity so that they can focus on enjoying their life's adventures. Her mission is to demonstrate that aging shouldn't mean slowing down, but a chance to level up your life. Welcome.
Thanks. Thanks, ladies. I appreciate it.
Yeah, we're super excited to have you here, and we're excited to dive right into this topic because it's definitely
Something close to my heart for sure.
but there's lots of changing research around it. So let's dive right in. In your experience, what are the most common symptoms that persist even when patients are on an optimized hormone replacement therapy protocol?
Usually the number one that we'll all get grief with, and I'm sure you guys will laugh at this one, is the weight. Why is my weight not falling off? So-and-so on social media said they lost 20 pounds the first day they took their hormones, and so we're like,
Yeah.
no, I
Yeah.
wish.
That's not how it works, but I wish it did.
I mean, wouldn't it be amazing? So yes, the weight and also hot flashes. Those are a very interesting bugger. And I'm sure you've seen that as well. That you're kind of diving down the different pathways. Like, is it the hormones? Is it cortisol? Is it blood sugar? Is it this? Is it that? What is it? The blood vessels themselves? Is it histamines? So that's definitely like the number two one that I'll tend to get. And then, if we round it out to three, because I could probably have an 8-hour podcast of all the different random ones. I'm going to go with aches and pains are one of the other ones that I see quite commonly, like secondary to maybe gut. But aches and pains are like one of those sneakier ones that a lot of folks will be like, I just keep hurting myself, or I feel like I twisted something, but I'm not sure. My ankle doesn't feel right. And then, I guess I'm going to round it out with 4. So gut. I can't leave the gut out of this conversation.
Yeah, for sure. I've definitely noticed in myself and in my patients that gut is, even on optimal hormones, gut is still an issue.
Yeah. And I feel like joint pain is a really
Yeah.
tricky one that persists even when you are on optimized hormones. Besides the weight. The weight is definitely the number one.
Well, let's be honest, yes.
But after that, definitely agree with those.
Yeah.
Makes
How do you clinically determine whether a patient's lingering symptoms are actually due to hormone resistance or like port receptor sensitivity or non-hormonal factors?
I do a lot of testing. I will be straight up honest that I do like to look at saliva, but I also like to sometimes in certain cases, I'll look at like, say, the Dutch test and the urine hormone metabolism, because I think it's important to see the metabolism always. And I'm seeing you guys nodding. So you're like, yep, me too.
Yep. We do that a lot.
Yeah, and I will do blood and sometimes compare. If I'm going to do saliva, I may do blood with saliva just to give me a really good sense of like, all right, what's in the blood, and then what's going on in the tissues. So back to the receptors and things of that nature. I'm always going to look at thyroid too, because it seems, that those two just happen to lovely be connected with one going up and, those estrogens and receptors too. So always going to look there. And then in terms of other tests, I like to actually look at GI map. That is still one of my favorites. I like Genova too, but we've had some Genova mishaps over the years, so I kind of gravitated towards GI map, and no offense to Genova, it just happens. And so, I'm going to do a lot of functional testing, but I'm also going to look at inflammation as a factor, blood sugar as a factor too, just to see like, is it, do we have other types of issues going on? Like how much is insulin playing out? And probably I round most out with a micronutrient test, because I want to know, like, did I miss something in the minerals department? Did I miss something in like the vitamin C department and the cortisol axis, you know? So I'll tend to kind of do a rounded out thing. Not every single person I see is going to do all those tests like that becomes quite an investment, but it kind of depends on what we're looking at. And if someone's been to 13 docs and, hasn't had any testing, then I might be like, okay, let's dive in a little bit deeper.
Yeah.
Sounds like you guys are pretty similar in that department too. I see a lot of nods.
Yeah. Well, and it's funny when we bring up micronutrients and vitamins and stuff, they're like, well, I eat healthy and I'm like, that's great, but our food system kind of sucks. And so you don't get a lot of vitamins and minerals that you should from healthy eating just because it's just not there in the soil anymore. We've completely wrecked the soil. So, yeah.
I use magnesium as an example for that a lot, where it's like, yeah, this food should be super high in magnesium, but our soils are incredibly depleted of that. So they're just not as high as they were like 50 years ago.
Absolutely. Absolutely. And it's such a point that, I think we're probably on repeat on that one over and over again. But I think it's great to like talk about it again in podcasts. I think we get to thinking, we can have this. I always thought when I graduated school, I was like, I'm going to work on a regenerative farm and I'm going to teach everyone to use food as their medicine. And it's going to be amazing. And I'm going to teach everyone to, cook. And then it's like, yeah, reality. Reality check.
Reality, but also it's like, I would love for everybody to eat their vitamins and minerals because it does absorb better and it is great. And I would love that. And most of the time I'm like, okay, well, let's do this first because I want you to actually make sure that you are eating your vitamins and minerals as best you can. And then we will add in what we need to because it's deficient.
Absolutely. Absolutely. Yeah. I am totally the same way. Same way.
I did want to ask you a follow-up question regarding that though, is like, what are some of your favorite like inflammation markers that you like to test when you're looking at that portion?
Sure. I'm usually going to run down my basic one, which everyone probably does now, is the CRP. I've started to switch to doing, instead of the cardiac one, to the general, just because I feel like I can see what general inflammation is looking like versus just targeted in such a sensitivity to the cardiac. I just want to see like what are we working with on a baseline there. So that's one of mine. I also will run like and it depends on the person, right? If I see someone that's overweight in front of me, I'm going to always look insulin too as a factor in inflammation. I'll always look at autoimmune markers as well, because as we know, if the hormones are going to shift, we may see a shift in what's going on with autoimmune cases. In my case, like when I was a teenager, I ended up with lupus antibodies off the charts, and then perimenopause, lupus antibodies off the charts. And so I'll look at that as another sign of inflammation. Another weird switch to it that isn't necessarily like a CD4. And so for those of you guys that are listening that may not be familiar with this, these are some of the markers that we may look at for general inflammation in the white blood cells in the bodies, like cytokines. I will run sometimes a cytokine test from, and of course the name's going to run out of my head. Array 12 is what I'll also run in terms of looking at all kinds of possibilities of infections in the body, if I'm leaning towards that side of things. And so those would be some more of my more obscure, like, yes, ferritin's in there to see what's going on in that department.
Yep.
But we'll often, depending on if someone comes in and they're like, hey, like I have these lymph nodes that won't seem to go away, or they'll have like a flip-flopped white blood cell. So maybe you guys are doing this too, the neutrophil and the lymphocyte, and seeing if it's flip-flopped where the lymphocyte's higher than the neutrophil. I'll often let them go, okay, we got to dive deeper there because we possibly have a viral or some kind of chronic inflammation issue. And then my other one that'll tend to round it out that doesn't necessarily go with a straight category of inflammation is sometimes I'll run candida antigens if I suspect it might be that as an inflammation.
Yeah, we do candida a lot also.
Yeah. It's a thing. It is a thing.
Honestly, my hypothesis is it's because there's sugar in everything and sugar feeds it a lot. And so I see candida a lot. Plus there's so many, antibiotics and stuff that people have taken over the years and never fixed their gut afterwards. So candida can grow easier in those situations. So yeah.
Absolutely. And I found just in myself, and I don't know if you guys have found this, is when my estrogen levels would drop off, closer to the period or after ovulation, I turned into like a sugar seeking like missile. I was like bombing for whatever I could grab. And I'm like, I know better than this, but I can't say no.
You know how us women are always just pushing through it, and then when we go to find help, we're often not taken seriously or told, oh, that's just part of being a woman.
Yeah, we've lived through it, prioritizing everybody else, and then our own health falls to the wayside.
That's why we started Blossoming Longevity, by women, for women.
We created programs that meet women where they are, addressing the root causes and all of the struggles that come with every stage of life. Like our Vitality program, it reconnects you with your youth and your life so that you can thrive through the years.
And with Clarity, we go beyond the skin to restore your health, clear your complexion so you can feel radiant from the inside out.
With our Silhouette program, we help you reclaim your strength, optimize your metabolism and your body composition so that you can feel great in your body again.
And with Harmony, we help you rebalance your hormones to heal from within so you can feel vibrant and ready to take on the world. That is why it's time to stop settling and start flourishing.
Visit blossominglongevity.com today. Yeah, definitely
Crazy.
carb heavy in the luteal phase.
Yeah, for sure. Personally and clinically.
Yes.
Yeah.
Okay.
one.
Well, so then which peptides or bioregulators do you consider first line adjuncts with hormone replacement therapy and when like fatigue isn't resolving or brain fog or metabolic issues persist?
Yeah. My number one, like I fell in love with this peptide probably almost a decade ago when I started working with football players and UFC fighters and in my practice, and BPC 157 was like on its own at that time. It didn't
It's
get
my
paired with
favorite.
PB 500. Yeah. It's like, where have you been all my life? Kind of like, wow. So I like it injectable if we're targeting a specific area of pain, but I like it orally because it doubles so well. And you guys have probably seen this too for the gut and brain and energy. Like, wow. Amazing.
Yeah, it really helped
Yeah.
my gut, is what it definitely helped with.
Yeah, I've found with a lot of patients, it's like that missing link. It's like you did the GI map, you cleaned everything up, but it's just like they're still having a little bit of GI stuff left, and you give them BPC 157, and it's like, oop,
Heals it.
better.
Isn't it crazy? And then they're like calling you. You're like, what did you do? That's so amazing. You're like, the peptide. Yes, yes. So that one's probably like my hero of the office. Most people are going to get that one thrown out at some point. That one's kind of my magical sequence. Depending on, if it's pain, we might cycle it in different manners and rotate to locations with injections. But orally, like, I think every woman kind of needs it. I'm like, just take this. You'll be fine.
You want this one.
Yeah, you're gonna want to have this one. Now, of course, the other big thing that's hot right now, and of course, super, I would say trendy, but also something that, like we started it off with, what's the one thing that lingers is the weight. I will use tirzepatide quite a bit in the office. I don't use semaglutide. I just don't find it to be as useful. Retatrutide, I feel like we can get results if we pair the BPC and the tirzepatide the best. That's kind of what I've seen. The two of those two look really well together. And then vitamin C. I have to have vitamin C with it. It's like the synergistic, like it just makes it all work well. With tirzepatide, I try not to get people over 2.5 on the base dose.
Yeah.
Because probably the same.
Yeah, we
Yeah.
start it really low and we wait a long time because as you know, it takes 3 months for it to really compound in the body. So if you're going to have reactions to it, you might not know until that 3-month mark when it's actually built up in your body. And then if you
And then
change it
you're on
before
a
then,
house.
it's already too late.
Yeah. Which is wild, and I don't know how you deal with this, but I have a lot of people who will be like, but my weight's not come on. I didn't drop 20 pounds in a week.
Yeah, that's
How-
after you've been on it for a few months and then it will. And you don't want to drop that fast either.
Exactly. It's definitely one of the things, I always kind of battle with folks. But the truth is like, yeah, I love the BPC. I love the tirzepatide there. Now, I've also played, and I don't know if you guys have played with Visugen at all, the injectable version of it. It's technically a bioregulator, but it works for the vessels and the endothelial tissue. And so I'll see a lot of women having, it can be anything from like the hemorrhoids start flaring or back to hot flashes. I've used that for it, especially if there's like a POTS kind of picture where there's dizziness, there's a neurological component. Sometimes I'll throw that one in there just to see if that one will help. Another biggie, and this one's more inflammation side and can be brain as well, is something called KPV. Have you guys used that one? Yeah,
Yeah.
Yes. Yeah.
I
Yeah,
love
that
that
one's
one.
good.
Yeah.
I like to pair that one with the BPC 157 and just kind of like round out those two.
Yes. Yeah, there's a formula. Do you use the company BioLongevity at all?
No, not that
No.
one, but Quicksilver makes
Mhm,
a combo one that
mhm.
we've used.
Gotcha, gotcha. And there's a company called BioLongevity that has something called BioGut, and it has, like, literally everything that a naturopath would totally want in a gut formula. Like, there's Tributrin, there's,
Oh,
there's
nice.
zinc carnosine in there, there's KPV, there's BPC. You're just like, someone, like, opened up the sky and it's all there. It's a little spendy, but it's definitely one of the ones that I'm like, if someone can't get the SIBO to go, if the
Mhm.
bloating just won't go and we've made sure that, nothing's wrong in the uterus, I'll often go to BioGut Pro. That's the name of it. I'll often go to that one and go, okay, let's see if that does the trick. But KPV has been such a game changer for even my moldy folks. I was, right now, we don't have the ability to get it as a nasal spray through a compounding pharmacy. We could get it through research sites out there, but I have loved using that one along with VIP. Have you ever used the
No.
vasointestinal?
No, not
Okay,
that one.
VIP. Mark that one down as a fun one because it's gut, but it also helps with the lungs and that tissue. Because so many ladies I'll see, like, all of a sudden, especially if they're into fitness or they've noticed, like, man, my ability to breathe is just not what it used to be. And my
Mm,
gut feels like it's bloated. So we're not getting that pump between the
right.
diaphragm and the pelvic floor. Sometimes using that one and the KPV together can be a really nice mix to just get that flow back again, to be able to
Okay.
breathe, but also get the gut. And so there's a couple companies out there that have VIP plus BPC in an oral
Oh,
form,
okay.
which is really cool. NuvaMed RX out of Arizona has a combo there that I really like, that sometimes I'll do that versus the KPV because it's not together and we're just trying to, find a solution. But yeah, that one, interesting enough, VIP also, a lot of people will swear by that to help with
Mhm.
concentration, focus, and brain.
Oh,
Off-label
nice.
use for
Okay.
sure on what it would do, but those ones would be like the magical combo in that department. Now, have you guys played with bioregulators much, like endogluten or xenoluten?
Only just a little bit, not really a lot in our regular practice. So not really. How would you can you walk us through like what your decision-making process would be for choosing like between peptides, bioregulators, or maybe even just like adjusting the HRT first?
Yeah. So what I typically will kind of do is go, okay, they're going to have the base HRT always, and we'll get them started. And then I just want to see what the HRT does
Mhm.
on a baseline level. And
Mhm.
usually I'm going to give anywhere between 8 to 12 weeks. At 12 weeks, if we still have, like, say, insomnia and we've got progesterone on board, their labs are telling me, like, I do not need to give them any more progesterone. Otherwise, they're going to be
Right.
acneed out and bloated and also
Yep.
unhappy,
Yeah.
and their estrogen looks okay, or say I didn't give estrogen because they're still getting periods and they have maybe excess estrogen, I'm gonna look at endogluten, which is a pineal gland regulator, and try
Mhm.
to help that route and see if I can get a brain back to body signaling going on.
Okay.
And so endogluten's typically that one, or you can put the bioregulator that's an injectable called Pinealon, which is very similar to it. You could use one or the other. I have some patients that they would rather inject than take a bunch of capsules. So,
Yeah. Okay.
hey, why not? So that's one of the ways I would think about it is if I couldn't get the sleep to regulate. And that's probably number 5 on my list of things that just hang around and can't, you know,
Yeah. The insomnia is terrible for
uh,
sure.
it's definitely something that this one too, I will say that I often with tirzepatide will put Pinealon in if someone's noticing that they were sleeping okay, then tirzepatide, I can talk. Tirzepatide caused them to have a little bit more insomnia. Then I'll throw that in. That's another kind of way I would stack it or put it together to be like, well, let's see if this will
Mhm.
adjust there
Okay.
too. So yeah, those are kind of some of how I put them together. The bioregulator, injectable or orals, those are kind of like icing on the cake when I'm like, okay, I just need a little more juice out of this, and I don't want to give them any more hormones because my MO, and I get a lot of crap for it from my friends, but the compounding pharmacy calls me the queen of microdosing hormones because I don't like giving big dosages because you've probably noticed, you go too far and then we're dealing with side effects from going too far.
Yeah,
And
for sure.
I'd rather just
It's
baby
all
step.
about the balance in the person, and everybody's different, and that's what people ask me all the time. "Well, is this the dose that, most of your people are on?" I was like, "No, because most of my people are on all different doses." It really depends on how you absorb it and how your body's working with it and how you feel on it because, like, both of us have very different hormone profiles. She's always been kind of a lower hormone profile, and that's how she feels the best. I've always had higher hormones, and that's how I feel the best. So, like, in that case, if we were both in perimenopause, we would probably have different levels of hormone therapy that would be on, and we would feel good at different levels.
Yeah. Yeah. It's so important to recognize that. And
Mhm.
unfortunately, I think a lot of the companies out there that are ones that I call them fly by night online, get your hormone kind of stuff. It's
Yeah.
cookie cutter. It's so cookie cutter and it makes me sad because now we have a
Mhm.
lot of people saying hormones didn't work for me. And it's not that they didn't work for you. They just weren't tailored to you.
Yeah.
Right. Right.
And I feel like it matters like the form also, and especially with those protocols that you can get from places like that, they might not be giving you the form that's like the best for you.
Mm.
And there's a lot of difference between like bioidentical hormones or just regular hormone replacement therapy.
Which a
Regular,
lot of times is synthetic
yeah,
and not
like
real.
all of those differences really do matter. And then like dosage and form on top of that.
Mhm.
100%. Yeah. Yeah. Not everybody needs a patch and pill. I mean, that's, I joke when I see that, that, okay, you got the patch and the pill protocol, which is great. For some people, it works wonderful. But we also have to think like topical or, oral or however, your body wants it. So yeah, I love that. I love the customization. It's fun. It's kind of like, I
It
feel
is
like,
kind of fun. It's like a puzzle. Mhm.
exactly. Exactly.
So, kind of going back to peptides, how do
Mhm.
peptides like BPC 157, TB 500, or Eptalon support cellular or tissue level changes that hormone replacement therapy cannot address?
Great question. So, what's happening with these guys is they're small little messengers. And this is kind of how I explain it to most of my patients. It's their small little messengers telling your tissue to repair. Estrogen's not going to do that. Estrogen works in a different, pathway of, and it's more general. And if your body's like, hey, I need the estrogen replacement to try to help me think, it's not going to put it towards your tissues. It's going to put it towards what it sees fit as being
Mhm.
the most important thing. And so, yeah, the TB 500 would be messages directly to your muscles. The BPC would be messages directly to tendon, ligament, gut tissue. And if we're talking about epitalon, however people want to say it, I've heard it said so many times, I really don't even know which way to say it right anymore.
Yeah.
Um,
Yeah.
and I can't say it like one of they call him OGs of peptides, Jean Francois Tremblay. He says it with a French accent. I can't even copy how he says it. So anyway, epitalon is going towards a cellular level. And so it's literally working on mitochondria, it's working on receptors within the cells. And so it's a different mechanism. And it's looking at the body, back to the more holistic approach versus just trying to target hormone receptors on their own.
Right. Okay. So I guess kind of coming back to the testing part of it too, with
Mhm.
all of this going on, what biomarker panels or like diagnostic tools do you rely on to identify when peptide or bioregular therapy is actually indicated versus just adding a little here, a little there?
Sure. One of my favorites and something that came to me while looking at multiple of the micronutrient tests is the amino acids test.
Yeah.
Because if we look at KPV, proline, valine, right, are like the main things in there. And I'm going, okay, so we've got proline, we've got valine, we've got lysine in this. Oh,
Mhm.
look, that patient has all three of these deficient. Huh. Okay. So that's one way I'd make a decision. Then the next thing would be if we do a cycle of it, meaning if I'm doing something that's a 20-day cycle or if I'm doing a 30-day or a quarterly cycle, I will run a test after the cycle to see how are we doing in
How
this.
they're absorbing it.
Exactly. So the amino acids I've discovered are kind of one of my best ways. The other would be looking at white blood cells. If those are on the lower end and vitamin D wasn't bringing it up, that would be another one. I would also be looking at, do we have a balance that starts to form with the hormones? Where before with, you've got estrogen way up here and say progesterone down here, and you're like, I can't give them anymore. They're not doing well if I try to give them more progesterone. And all the diindolylmethane in the world isn't bringing that estrogen down. Sometimes I'll see it kind of regulate on that level. I've seen GI maps turn around, with the calprotectin and the high, inflammation markers just drop. And so it's a
Nice.
little targeted to who I'm working with as to what test I would do, but that's a big example of what I'd be looking at: inflammation markers, CRP going down, even cholesterol going down if I'm doing like Vasugen, BPC, and you guys are nodding, so you've seen that too.
Yep. Yeah. Sometimes even with just hormone replacement therapy, when women have been in menopause and they haven't gotten any hormone replacement therapy, their cholesterol can skyrocket. And when we get them on the correct dose for them and they're starting to feel better and everything, we check it like 6 months down the road and it's lowered already. And people don't realize how much hormones do for our body. And it's not just, the hot flashes or the sleep or the crankiness or any of that. It's literally doing all the things in our body.
Absolutely.
But I
Yeah.
have found like with cholesterol specifically, it's like you get on the hormones, it gets better, but it's still like not where you want it. And then you repair that gut tissue, and then it's like, okay, now things have gotten better. The inflammation came down, now the cholesterol came down too. So yeah, yeah.
Yeah. Yeah, I see that too. It's good to hear that we're all on the same like page here. I love it. I love it.
So speaking more about clinical wins, where do you see the biggest clinical wins when integrating peptides and hormone therapy, like mitochondrial function, inflammation, immune modulation, tissue repair? We've kind of been talking about that, but if you could summarize that for
Yeah.
people.
I feel like people get their life back.
Mhm.
Honestly, I get more messages from people who are willing to try the peptides, and they're like, I feel normal again. I feel human again. My brain's back. I have more energy. It's just like the ultimate in vitality is restored, and I'm not having
Right.
to use crazy amounts of hormones with a lot of
Mhm.
folks because I've had multiple men. I know if this is a hormones conversation more maybe geared towards women, but I've had multiple men who've been really super dosed on testosterone, and we add in the peptides and bioregulators, and we drop their dose by half, and they feel so much better and their blood sugar regulates. So at the end of the day, I mean, the best way to sum up this is it's the ultimate in really achieving vitality for folks. Yeah.
Yeah, definitely.
Yeah.
Um,
I love how you put that.
yeah, that's kind of how we're more of like health span versus lifespan kind of thing. Like we want you to have a long lifespan, but you need to feel healthy because otherwise,
What's the
why
point?
do you want to live long if you feel crappy?
Yeah.
You know, you want to feel good when you're living longer. So speaking of living longer, what are some of the safety considerations or like contraindications or special monitoring steps that maybe clinicians, if there's any watching today, could take to when you're layering all the peptides onto the existing HRT so that way even patients, anybody who's watching can ask their doctor to run these or ask them about them at least.
Yeah. I mean, the biggest one safety wise is where you're sourcing from. And unfortunately, right now, the peptide and bioregulator space is a little volatile. So we have to watch where it's coming from. I have certain companies that I really like. I had mentioned BioLongevity. There's biolongevitylabs.com. It's one of my favorite companies. I also use NuvaMedRx.com. Guys might have some of your favorite companies too. And I think it's important for folks to hear those names because in the last, I would say, year, I have seen more peptide companies come out of the woodwork that I
Mhm.
don't know. And
Yeah.
it's scary. So before I say the other things, what companies do you guys use in particular if you feel comfortable saying them. I'm just curious if you're using any other ones.
Um, New BioAge is kind of the one of them.
Mhm.
It's kind of the main one, and then, like, we haven't used a lot of injectable, so we've
Okay.
been able to do a lot more of the oral, so we have, kinda kept with the brands that we typically use and source it for the oral and have done a lot less injectable, so it is a little bit less scary for us in, like, sourcing.
But we do
But
have a really good compounding pharmacy that we trust, and so
Nice.
we can get things through them. So,
Nice.
yeah.
Nice. And that's something that for folks to ask their doctors, especially if they're working with a naturopath or
Mhm.
someone that's working with peptides, just see who your doctor's working with on that case. And so that's number one. Injectables, yes, it comes with another little level of risk. And it's making sure that your doctor walks you through how to reconstitute the peptides. So at this point in time, if you're getting peptides off of research sites, you got to reconstitute. So you've got to put bacteriostatic water into the vial. You can't just put anything in there. And I sit down with every single one of my folks to watch it. Like I teach them how to do it. Also teaching how to do injections. I'm sorry yes, there's plenty on YouTube to watch, but
Yeah.
you want to have a doc who's going to walk you through it. You want to make sure that you've got
We
all your
have them do a visit and we watch them and we show them and, like, place where they're supposed to do it and show them how to do it. We don't let them do it the first time by themselves. We
yes.
usually have things shipped to our office so that we can actually, like, show them.
Yeah. It's so important. And so, if I can't stress anything enough with safety with injections, this is so important. Now, one of the things I do divert a little bit from the standards is because I'm an acupuncturist, I will show folks acupuncture points to inject into
Nice.
subcutaneously for certain points, depending on what we're doing. If we're looking pineal, if we're doing some things like that, it's kind of just another up-leveled version of biopuncture. But at the same time, we're making sure I'm watching what they're doing and we're walking through it. Now, the other big thing with this and how to measure, safety is, of course, if you don't feel good on anything, stop it right away. Let your doc know.
Yeah.
And we need to go from there. I tend not to see the side effects with these. Yes, tirzepatide, the GLP-1s, that's a different story. But with the bioregulators, with any of the bioregulator peptide injection kind of things, it's minimal. Of course, there are always the chances for these kind of things. The other thing to
Right.
be monitoring is looking for histamine reactions. So itchiness, rashes, hives, any of that means something's not right. The body's throwing up some signals that is just not liking what you're doing. So those are going to be some of the other monitoring tools. The other thing is if white blood cells stay high and where
Mhm.
neutrophils are high and there's no infection, nothing's going on, lymph nodes are swollen, that kind of stuff. We want to look there. Those are kind of my big ones in this case for these guys. Don't know if you guys have any you want to add to it, but those are kind of like my biggies to monitor that make sure we're doing okay here.
Yeah, I think the biggest thing that we always tell people is you need to make sure that your practitioner actually knows what they're talking about because there was so much misinformation about hormones and
Right.
peptides and all the things. And, like, a lot of people did not keep up on the research. As naturopathic doctors, we are, like, huge into research, which I think a lot of people don't understand that that is our thing. And so we've always kept up on all these things. And since peptides are, kind of more of a natural thing, we have found that a lot of, like, conventional docs or in the conventional space, not functional medicine's coming along and learning about it, but they don't know what they're talking about, or they'll just put them on, like, an oral birth control and there you go, there's your hormones. So
Right.
we always tell people, if you're, moving out and to a state that we're not licensed in or something, you've got to find a practitioner that actually knows what they're talking about. And it's okay to, kind of interview them and say, do you work with these things? And it's fine if they don't. Like,
Yeah.
if they're willing to learn about it and they're willing to actually find out from somebody who knows about it, that's still a good practitioner. It's just whether they're like, no, I don't really do that. It's fine. You don't need those kind of thing. You got to make sure that you're working with somebody who knows what they're doing, or if they're willing to learn and
Yeah.
they're willing to actually do the research and not just kind of, follow what's hot at the moment.
Absolutely. Yes. If they looked at TikTok that day and they were like, oh, we should inject this way. I think you brought up another thing in my mind that didn't come at first is dosing schedules. That's
Yeah.
really important with peptides and with the bioregulators. You're not on these 24/7. These are
Mhm.
cycles. And I think that's something that I didn't think about, but I need to mention that yes, These are cycled. They're not meant to be on for life. I often will cycle them quarterly for folks, depending on what we're working with, and then drop off to like once or twice a year as maintenance if it
Mhm.
seems fit. And sometimes, in some cases, we don't have to go back to them. It's all a matter of looking at it. But yes, if someone tells you to take these day in, day out and not stop, that's a warning sign that
Yeah.
something's not right. Yeah.
Yeah, we usually do 3 months for the first to try everything out and then have them go off to see if they even need to go back on it.
Yeah. Yeah. It's huge. It's huge to mention that. So yeah. Yeah,
Yeah.
those would be my other biggest concern, especially in the realm of peptides and bioregulators. Hormones on the other side, like you said, you can feel someone out and find out what they know when you ask all the different forms. Ask them what forms of hormone replacement therapy do you recommend? And then if it's just like two things, you're
Yeah.
probably not in the right place.
Yeah, exactly.
Yeah. And I think it's, something that we should highlight, that what makes peptides and these bioregulators so amazing is that it's not something that you have to be on forever. They are actually something that heal you and like repair these tissues. And then you get to like come back to them if you need them, if you need to come back at all. And I think that's something as naturopath we really try to achieve with our patients, is to like, I don't want you to stay in my office forever. I want to get you better and like out of here so you can live your life so you're not having to come to a doctor anymore. And I think that's what makes these things really amazing, like amazing tools.
100% agree. I want to see my people out skiing or biking, or out on a walk. I
Yeah.
definitely, want the best for Vitality Farm for sure. Yeah.
On that note of like wanting the best for our patients, can you share a case example where hormone replacement therapy plateaued, but symptom resolution improved significantly after adding the targeted peptides or bioregulators that got them out to do those things we were just talking about?
Absolutely, absolutely. Gosh, I have a lot of different cases where there's a common theme, and I'll use the common theme one because I think it's something that many women will deal with. And what'll happen is typically we will have a woman that is in, kind of in that perimenopause to menopause, like the periods are getting funky. They're not, they're either super long or they're super short. And sometimes they skip a couple months. So we don't know exactly where they're at in terms of hormones and what to, like what would be the exact perfect schedule there. And in these cases, I'll often get the Mira out. This is a urine
Yeah.
for the folks that are listening. I love Mira. I don't know what we would have done without Mira, or what I would do without it now, or how we even survived without it. But able, being able to use this little device that you can dip your urine sticks in, and you can measure multiple different things. In particular, when I have a woman who doesn't have a regular period, I love to use that. So I can look at progesterone, I can look at estrogen, we can see if there's a pattern going on. And so one of the most common cases that I have is not knowing, and a patient's going to come in and be like, well, my doc told me I needed birth control, and it's because my periods are all over the place. And like you had said, someone just handing you birth control and saying that's hormone
Yep.
replacement therapy, it's not even, they're not even hormones.
It's not
Um,
even close.
it's not the same.
I know.
Um, it's so not the same. And so when this happens, having the mirror to know like what your pattern is can help us to dial in when to supplement, what, when, and what kind of range. And so most of the time, what I'm going to find, of course, and you guys probably find this too, is progesterone kind of will help quite a bit at first.
Mhm.
And then we're like, should we use estrogen? I don't know. They've got some pain. They've got some brain fog. They're complaining about the weight. Maybe the progesterone's got them a little more puffy and they're not so happy with me. And we're not making the progress. What do we do? What do we do? And
Yeah.
so this is where I like to insert the peptides first, because if I have a woman that has okay levels of estrogen, they just are doing a little bit more of a roller coaster, I will tend to divert towards holding out on putting the estrogen in right away. I'll use a little bit of the progesterone. I may use a little testosterone if they're like, I'm so tired, I can't get out of bed. Then I'll be
Yeah.
like, okay, let's use a little bit of that. But most of the time, the most common case is when we've got this all over period. We've got the like, I am going to lose my mind. I'm anxious, can't sleep. Let's give you the progesterone. Great. Then what I'll do to try to help the body is give it a little bit of the BPC. That's where I weave it in. And, you know, like I said earlier, I'll choose to do it orally or I'll do injectable depending on if there's aches or pains. Or if we're just looking at like my gut is off, I can't focus, I'm
Hmm.
gonna do it that way. And so a lot of times we'll get over the hump right there. The bloat will go down. Sometimes I'll see weight come off with BPC in that case. And then it's like, okay, we're good. We hold stable here till the body decides to finally either stop the periods
Yeah.
altogether, and then
Yeah.
we move to the next progression. And that's also what I love telling folks about is like we'll hit plateaus and then we go to the next progression. We'll hit a plateau and then we go to the next progression. And that is probably like the best case study I can give to folks in terms of how we just keep leveling up and move up.
Yeah, I explain that a lot, all the time. Anytime I start hormone replacement therapy, I'm like, this is your dose for now. And
Mhm.
then when you start having symptoms again, or we need to do something else, we're going to go up because your ovaries stop producing. They slowly kind of stop producing, and your adrenal glands, most of us barely have adrenal glands anymore. So like they're not helping that much. So it really, I do a lot by symptom picture because it really can just, you're up here and then it kind of goes like this, and you got to kind of match it and get them right back to that normal level. And I was like, this is not going to be your dose forever until, you're postmenopausal and then we know what's going on. But in perimenopause, especially, it's up, down, all around. It's craziness with your hormones. I know the BPC 157 is a good one to help with like the bloat and the weight loss and stuff. I found that it helps with the aches and pains orally also. Obviously, I'm not injecting it to the direct ache and pain, but I've seen that it's helped the arthralgias that happen a lot in perimenopause and menopause. Is there any other peptide or bioregulator that you really like for weight loss, especially if somebody does not want to do a GLP-1?
I use KPV for it.
Okay.
I will typically put KPV and sometimes BPC together.
Okay.
Just I love those. I love BPC. Like it is my best friend.
It is. It is mine too, and I will be taking it right after lunch.
Nice. Nice. Yeah, I usually use KPV and so there's a fun one called Klo, KLOW. I lovingly call it Smurf juice because it's blue. So Smurf juice might be something else that I'll use, especially if someone's like, I don't want to go on tirzepatide or semaglutide or any of those. I want to lose some weight. My skin's sagging, I've got the aches and pains. And for those folks who are listening that are not familiar, like what is this Clo thing? It's KPV, it's BPC 157, it's TB 500, and then we've got copper and GHK in there too.
Right.
And so those ones, like that's my other. If someone's not losing weight and they're like, there's no way in heck I'm doing a tirzepatide or any of that. And if someone's got, I call it like the little belly pooch, they don't have a lot of weight to lose. And
Mhm.
tirzepatide may be almost dangerous in some cases for someone who's only got like 3 to 5 pounds. I will divert to KPV or Clo in that
Okay.
case. Yeah.
Nice.
Nice. So, I know we're kind of in a tumultuous time regarding peptides and bioregulators, and things could be changing.
Yeah.
But, looking ahead, are there any emerging ones that you believe will become essential tools for clinicians in treating age related decline, if we're able to access them?
Yeah. I really hope that we could have the KPV on board because I feel like it really does help with so many things. I think BPC is somewhat here to stay on
Mhm.
certain levels. So that one I'm not going to go but too far in, but I'd love to have the KPV around. I would also really love to have the pineal on for women in particular to help the circadian rhythm reset that
Yeah.
it gives. I think that would be one that I would say out of like all of the other ones out there, that one's a really nice one. I would also say Visugen would be great. There's also another one called Ventfort for vessels too, but I like Visugen because it has the epithelial support
Right.
and hormone support. So I'd be thinking those, like those are ones you want to be looking at, keeping an eye on. If we can keep VIP around, so that guy, that is really great, like I'd mentioned before, for the lungs and the gut as a combo. So those would be kind of like my favorite ones if I had to pick ones out there, but also ones that are emerging that for women in particular and men, because they have hormones too. But those would be like the best if we're looking at hormones
Mhm.
and specifically wanting to dial things in better, those would be the ones I'd keep around.
Nice. All right.
Yeah. Mhm.
Well, is there anything you wanted to add to kind of like wrap this up, or like if people want to get a hold of you? Because I know you said that you're work out of Washington, or anything like that you want to add to the end of the topic. End of
Absolutely. So one of the big things with all of this stuff, like you had mentioned, it's a little bit of a volatile situation in terms of when things will be available, if they're out of stock, if they're back in. The bottom line is link up with a practitioner who knows what they're doing, just like we've talked about today. They will know what sources are good. They will know where you can find things and what's going to be the safest sources for you. Do not rely on random social media influence unless it is someone that you can trust, that is a I'm going to say doctor and or medical practitioner, nurse practitioner, somebody who understands and really can talk the talk here. That's going to be the most important thing. The other big thing is like, these are different. They're not how we would normally think about medicine. We've been taught that you need one thing, you need to keep taking it over and over again, day in, day out. And so I ask everyone to just open up their minds a little bit on what could be possible if you looked at your health as a way to optimize it instead of kind of coming in the back end and trying to treat things. Look at how you could prevent things just as much as you could work on things. So yeah. And you can find me if you're looking on Instagram at DrJannineKrause. So at Dr. Jannine. My website's docjkrause, N as in Nancy, D as in dog.com. You can find me on the Health Fix podcast, and these two lovely ladies will be on my podcast here soon. So come check out our interview there as well. And those are all the main places to find me.
Great. Well, I enjoyed talking to you so much. I think I learned a lot.
I did. Yes.
I
me
hope
too.
all of our listeners learned a lot too. And I look forward to seeing you again on your podcast.
Okay.
Thanks for watching Hormone Heroines.
If this episode spoke to you, follow the show and share it with someone who also needs to hear it.
And write a review. That helps more people find their way back to balance.
See you next week.